Okay, good evening. I'm Margaret Hafferly. I'm the chair of Council One. We all usually chant we're number one, but we're not going to require anybody to do that. So we typically meet the third Tuesday of the month. We're one of the few councils that meets regularly in person. So we often do a hybrid, but when we have presentations like these, we do it online in Zoom because it can be very distracting. I will mention that we're not meeting next month, August, because we'll be on vacation, as will probably many of you. And then just a quick reminder, the purposes of the regional councils are to be the voice of families within the system. So one of the things we do is provide information to families about services from DDD as well as from Perform Care. At events like these, we had an open forum our last meeting. We gather information from families and their concerns, and we bring them forward. And then council members from every regional council meet with DDD and DCF, which is the children's group. Most families know it as Perform Care. And then we compile that information in an annual report. So we'd love to hear from families because we always send that information on. I just wanted to let you know that there are council members on the screen. I don't know what order you're seeing them. Council members, just wave. Okay, those are members of Council One. So you'll meet us in September on the third Tuesday of the month. So with no further ado, Trish Brennan is going to talk to us about the Community Care Program and the waiting list.
So good evening, everybody. I am going to share my screen in just a minute. I am thank you for inviting us here tonight. I am joined today. So my title is Director of the Office of Education and Self-Directed Services, the Priority Waiting List and Special Projects. I'm also joined tonight by the Assistant Director, Jessica Lycona, and the Supervisor for the Waiting List Unit, Kimberly Jessamine. So they're here tonight. They're going to answer some questions for you. And at the end, you're going to have even more chance to answer some questions. So I'm going to take a section and share my screen so we can get started through some of the presentation for all of you. Just give me a second here and I am going to make sure that you can all see it. Everyone got that? Everyone can see it? Are we good? Yes, great. So hold on for a second here. Let me make sure I got everything perfect. I'm gonna move to the next slide. So every time I've been doing presentations lately, every time our whole team has been doing presentations, we've really been trying to make sure that we hone in on really getting back to the roots. What's the mission of the division? So again, the Division of Developmental Disabilities assures the opportunity for individuals with developmental disabilities to receive quality services and supports, participate meaningfully in their communities, and exercise their right to make choices. Just kind of making sure that we start everything off with those principles. So what are we going to learn today in the session? So we're going to talk a little bit about what the Community Care Program waiting list is, what it means to be reached on the priority waiting list, how to be prepared, and then answer some questions that you may have. Again, so the Community Care Program waiting list establishes a means to allocate limited funding among people in New Jersey with similar needs and circumstances. Again, like needs, like supports, like resources. The availability and opportunity to access the Community Care Program services is limited to the division's funding upon a given year. And there are specific criteria a person needs to meet in order to access the Community Care Program. So one of the questions that I always get asked is, how many people are on the priority waiting list? So this is actually, we updated this yesterday. So as of yesterday, there are 2,207 people on the priority waiting list, 1,784 people on the general waiting list, and the total number of people right now on the Community Care Program waiting list is 3,991. Knowing that every year we are able to take some people and reach them, but all the time more people are going on to the priority list. So the number doesn't seem to go down, but we do take more people off in each year for team. So what are some of the eligibility criteria that are clearly outlined in our regulation? One of the easy ones to kind of think of is that both parents are over the age of 55. Additionally, so it could be the person living with a caregiver other than their birth or adopted parents who are providing voluntary without pay care and can no longer care for the person. There's a clear risk of abuse and neglect. So there's some clear criteria that are outlined in our division circular and our regulation to meet. But one of the things that is pretty much an automatic is that both parents show that they're over the age of 55, as well as if they're under the age of 55, they can fill out this information, meet the specific criteria that's outlined here, and then it goes through something called waiting list review team. So again, it can be requested by the person, the family, the guardian, a caregiver at any time for anyone over the age of 18 who qualifies for division services. So if you qualify for division services, you can request to be put on the priority waiting list. Your additional approval is subject to a specific eligibility criteria as it's outlined. Addition to and subsequent selection on the priority waiting list is an opportunity to apply for the community care program, but does not guarantee that the person is eligible for community care program. So just to kind of give a little piece of this, there's some questions on here that we frequently get asked. So does being enrolled in the community care program mean I have to move into a licensed residential setting or group home? So no, that's not what it means. Prior to 2012, this was the priority waiting list for residential services. And it was the priority waiting list, you may not know this, there's a waiting list for day program services, all in the same regulation. In 2012, it was rewritten, and 2013 is when we started to implement parts of the supports program and have 2 waiver services. So when somebody is reached at the top of the priority waiting list, they are not automatically enrolled in this community care program. And it does not mean that it's your only chance. That's a pretty much a myth right now that it's out there that I was reaching the top of the residential waiting list. I have to take it now. I have to take a group home placement now. No, community care program means all encompassing supports and services to meet the person's needs based upon their level of care and be able to support the person within the best setting for them in their community. So another question, what happens if I move from the priority waiting list and it was determined that I am not eligible for the community care program at that time? So if your needs change in the future, if you weren't eligible, you did not meet level of care, I'm going to talk about a little bit more of this later, you'll be able to work with your support coordinator for those next steps. Again, questions about the general waiting list. So he would say, I'm not sure if I'm on the priority waiting list or I'm on the general waiting list. There's another question that comes through us all the time. I didn't get a letter. Which waiting list am I on? That may be requested as well at any time. And if the person does not meet eligibility criteria for the priority waiting list, they are placed upon the general waiting list. So again, when I meet eligibility requirements for the priority waiting list, do I just move from one waiting list to the other? So we hear a lot of times families say, well, I'm on the general waiting list. Does that mean I automatically, when I turn 55, get put on the priority waiting list? No, you need to work with your support coordinator, or you're able to do it yourself online as well to meet the requirements and submit to be placed on the priority waiting list. What happens if my situation becomes an emergency? Can I access the community care program if I'm not on the priority waiting list? Yes. So if you meet emergency criteria, you can get put on the priority waiting list to get immediately taken off for an emergent situation. It's another piece of this. So these are the questions that we frequently get asked, and we want to kind of get them out of the way so that you are all able to kind of, think about what the next steps of the process. To be added to the waiting list, I'm going to also say one of the questions I frequently get asked when I'm going through some of these pieces is, will I get a copy of this? Yes, I gave it to Kyoko. She's going to be able to get this presentation out to all of you. So if you see this information of how to request to be added to the priority waiting list, she will get that information to you. It's right here, but don't worry about copying it down. She will be able to get that to you. And if not, you can always email us. Again, as per division circular, every single year we are obligated to tell people what their rank is on the priority list. So some of you, and if I was able to see all of you, I would say, how many of you got a letter from us this past June? Because Mercedes put her hand up. So every year, and it's not a every year we get together and we have we are, Kim and Jess attest to this. We play music and we have envelopes and we make sure that the mail merge is there, and we stuff all the letters so that and we check it all so that everybody who's on the priority list gets their current rank number. Typically, it's the end of the fiscal year, so that they get, and annually you get your number where you are in rank. And people on the general waiting list don't get a letter. So additionally, just so you're aware, and this year's the first year it actually happened all exactly at the same time, your letter that you got in the physical mail was part of a mail merge that got directly uploaded into the iRecord at that time. So if you didn't get a letter, because sometimes the US Post Office doesn't always, come through, your support coordinator will be able to access that through the iRecord, print out the letter and get it to you as well. And then they can see where you are in rank. So every year we are obligated to get you that information where you are in rank on the priority list. So again, ranking letters, they're mailed out in June typically. They're right in the iRecord. They're emailed to the person and the guardian, put in the physical mail to the person and the guardian, and uploaded into the iRecord. So a lot of times people wait for that rank letter. They've been put out this June. We want people to kind of say, okay, so now what? I got a rank letter. What's it mean? What do I do next? How do we get there? So again, it informs the person, the guardian, the number on the list. It provides support coordinators knowledge of the person's priority waiting list status and the rank information, so they can start to help prepare you for the next steps of where you are in rank, for the next pieces. So another question I frequently get asked, and our whole unit is, how many people do you reach from the top of the list? I've got my number here from my letter that you just sent me, but I don't know what that means. I don't know what being number 250 means or what number 1000 means. Typically, we're able to reach between 200 and 400 people, depending upon the budget allocations each fiscal year. So what I can tell you is in fiscal year 2022, we were able to outreach to 200 people. This past fiscal year was 400 people. And this upcoming fiscal year budget year, another 400 people, which is huge. Because, the past from 2016 until now, it's been about 100, 150, 200, 2023 and 2024, 400 people going to be able to reach. We have, again, not outreach to the people yet for this July because we had to wait till the budget was signed, get our staff geared up, and so we'll be outreaching to them in September. So what happens when you've been reached? Okay, so how do I know I'm reached? What are my next steps? What do I do? So you're going to get a letter in the mail that's going to inform you that you've been reached in the priority waiting list. It's going to be mailed to you, and you and the person that you support, and list in the iRecord, uploaded, and it'll be sent out with your transition education liaison's name. So the person that's assigned to you to help guide you through this process, to help educate you as part of a member of our team, is going to be working with you to get you to the next step. So I've been reached. Now what? They're going to work with you through that. Now what? What's my next step? How do I get there? You'll have a transition education liaison to help you through that process. Part of our team, they will work with your support coordinator as well and educate them as to what this means that you've been reached. Oh, I just hit too many things. So the other question is, when I'm reached, so if I'm reached at the top of the priority list, am I automatically eligible for the community care program? The answer to that is no. When you're reached at the top of the CCP waiting list, you're going to receive a letter letting you know you've been reached. You're going to have your assigned transition education liaison who's going to work with you through the eligibility determination process to see if you're eligible for this community care program. What happens if I'm determined that I'm not eligible for the community care program? You're going to receive and continue to receive support program services, and your transition education liaison is going to work with you for next steps and trying to figure out what services and supports best meet your needs. Again, another question. If I'm enrolled in the community care program, does it mean I have to move to a licensed residential setting like a group home or supervised apartment? No. Once you're enrolled in the community care program, you're going to work with your support coordinator, and you're going to work to incorporate these additional supports and services within your individualized support plan that best meet your needs. You can receive community care program services and supports wherever in the community works for you, in your own home, in an apartment, in a licensed residential setting. It's all based upon what the person is looking for. We're really trying to take, as our transition education liaison reaches out to people, a person-centered approach for every aspect. What determines if I'm removed from the priority waiting list and it was determined that I'm not eligible for the community care program at that time? Again, if your needs change in the future, you're going to work with your support coordinator about accessing additional supports and services. So, okay, so I've been reached. What next? What happens? You're going to have the transition education liaison is going to make a phone call to you. They're going to talk you through the next steps. They're going to work with you to review specific aspects of your individualized support plan. Your support coordinator is also going to be informed, so they're going to talk to your support coordinator, be like, hey, I know this person's on your caseload, they're going to reach the priority waiting list, we're going to be working through some of the next steps so we can have them on the waiver service that's most eligible for supports and services for them to receive. They're also going to invite you to for a welcome session. Again, you're going to work with the eligibility determination piece. When you have a transition education liaison reach out to you, they're going to make sure that they're going to confirm your Medicaid. They're going to go through your New Jersey Comprehensive Assessment Tool, otherwise known as the NJCAT, for accuracy. So they're going to go through all those pieces with you to make sure we've got it right, make sure we've got a good picture, make sure that all the services and supports that you're currently in need of are captured in these pieces. They're going to look at the services and supports that are currently being provided and what other additional things are needed. And if you're requesting, based upon the NJCAT scores, a level of care, they're going to work through with you to complete that level of care assessment and figure out which waiver program you're most eligible to receive supports and services from. Again, in order to receive services through one of our waiver programs, you need to be enrolled in Medicaid. If you are not, the transition education liaison will confirm all the pieces of Medicaid, and they will give you more guidance as to how to obtain your Medicaid. So if you fell off, they're going to be working with you through every aspect to make sure you're properly enrolled on the right waiver service prior to being removed. Again, they're going to review the New Jersey Comprehensive Assessment Tool you've been reached. They're going to have this in-depth conversation with you. They're going to schedule a time to say, hey, let's go through to make sure we've got all the accurate pieces through. Once it's current and accurate, they're going to discuss about which waiver service program that you're most eligible to receive supports and services from and move to the next steps. What does an ICF level of care mean? This does not imply that a person must move to an institutional setting. It simply refers to a level of support a person needs to be successfully supported in the community. So this is what it means to be on a community care program. They need to meet these specific criteria that are listed below. If based upon your NJCAT scores, you're not eligible for the CCP just based solely upon the NJCAT scores, your transition education liaison will offer the option to you to have a level of care review in order to further evaluate the community care program eligibility. It's an open-ended written narrative, and so your transition education liaison may ask you for additional documents. Anything that supports all these next steps, they're going to work with you to get that, to put together a really good comprehensive documentation of meeting level of care. They will then submit it to there's a unit in our division that goes through level of care. So they will go submit it to them, and they will notify our transition education liaison and the family about approval or denial for the next steps. And if they're approved, they will work with the support coordinator to get a brand new plan up in place for the all-encompassing community care program. If they are denied, the family is going to receive a letter in the mail, inform them of the denial, and explain their appeal rights. And as well, the transition education liaison is going to work with the family to inform all parties of every aspect of this. Again, if the level of care review is denied, the person is going to receive a letter in the mail, and it's going to talk about the right to appeal and the exact pieces. And an appeal is a virtual in-person conversation between the person, their family, their DDD team, their support coordinator about the next pieces. So again, there's two waiver programs at the Division of Developmental Disabilities, the Community Care Program and the Supports Program. It's, as you work through the transition education liaison, as you reach the top of the priority waiting list, they're going to make sure you're receiving services and supports that from the waiver program that you are eligible to receive and that meet your level of care, supports, and services. Waiver criteria. Most of you probably understand the waiver criteria. It's been on our pieces, and you're all part of the Family Support Planning Council. So the supports program is 21 years of age or older. Both programs, you need to be eligible for Medicaid, as well as eligible for Division of Developmental Disability Services. In order to be eligible for the community care program, you need to be reached on the community care program waiting list or determined by DDD an imminent risk of homelessness or emergent situation. So again, not everybody's going to be eligible for the community care program, but they will have a discussion about the additional supports that are available. Your transition education liaison is going to try to link you to different aspects, community supports, next steps. They're going to walk you through all the different pieces that go along with being reached in the priority waiting list. And they're going to work with your support coordinator in tandem for the next step. So they do outreach to you, and they kind of walk you through the next steps prior to removal, so that every piece is in place for an approved service plan that meets your waiver eligible specific needs. Again, the support coordinator is going to work with you through the planning process. You'll have the ability to choose self-direction or provider managed, figuring out what it is that I'm looking for. You can choose to receive your services wherever you want, however you want. Again, person-centered at the primary section, working with our families to say, okay, what is it that you're looking for? Many families say to us, we don't even remember, just to give you a picture, right now on the group that we're outreaching to in September, they are placed on the priority waiting list in 2013. So if they were placed in the priority waiting list in 2013, we find out that sometimes they don't realize their why. What were they looking for to get out of being placed on the priority waiting list? What are those next steps? What is it that I'm looking to gain? And asking those key questions, not just, I want these services, but why? How do we get them? What are the community connections we want to build? Again, we want people to create really good, meaningful lives. We offer them the opportunity of self-direction, or provider managed, and figuring those pieces out. So self-direction, a person can utilize waiver program services in their own home, a family home. They can self-direct their day. They can create their own schedules. They can hire and supervise their own staff. If somebody is going provider managed, the provider is doing all those pieces. They can receive waiver program services in their own home by one provider, a group home, a supervised apartment, a licensed state program, a licensed setting, where the provider is managing all those pieces. One of the awesome things that we've been doing for the past, I guess, 3 years that we've outreach, I think this is the third go around, is we partner once we've reached people. So it started during COVID. So we wanted to get people together that have been reached to figure out, okay, so what are my next steps? So we partner with the Community Living Education Project, otherwise known as CLEP. And we hold some sessions for families, and then if they want to invite their support coordinators, they can, to talk about, what it means. At that same time, they can see, put a face to the end of the telephone cord that they're talking to their, transition education liaison over, and get to see the person. They also get to hear some stories from families with lived experience. So the families there work for the Community Living Education Project. And they share, there's one family who the person is self-directing, is on the supports program, someone who is self-directing on the community care program, someone who's reached on the community care program and is in a residential setting. So giving you a picture of what it was like, showing you those different aspects, and then having a chance to ask questions, learn from each other, because some of this, you all might have similar questions as you're reached. We give people a chance to go to these virtual sessions, and learn from one another, learn from us, and then hear from people with lived experience. So once people are reached, they talk to their transition education liaison, and at the same time, some of these sessions are happening so people can have a better education and start to think of it, okay, I've been reached, now what? How do we get to the good life? What are the next steps to complete? So what can I do while I'm waiting to reach on the list? So that's another question I ask people to ask, right? I got my letter. It says I'm like number 450. So that means for probably about at least a year and a half. What do we do while I'm waiting? What can we do? And what can we do to help the people around? What are the next steps? So you can start to think about what it is that you want and what it is that you don't want in your life. You can think about what's currently working and what's currently not working. You can work with your support coordinator and start to reshape some of your goals and objectives, knowing that you're going to be reached pretty soon, right? That's that next step. You can also look into some of our housing subsidy programs and see, just better educate yourself. As well, our housing subsidies are through our supportive housing connection, and they're going to help people to get that housing subsidy, and they're going to work with their support coordinator. Again, the link is here. If you have additional questions, we will have this out to you as well. We want people to explore the services and supports and know that they're evolving, right? So as you're reached, I want you to all think, okay, I've got my letter. What are my next steps? How can I be prepared? We want to think about how services and supports are evolving. In the past, it was the person, the family, and the community, right? And then we got services and supports for somebody. And when it was isolate, because if you have this, you need to go over here to get those right services. What truly should be, and as we're moving forward and utilizing the community of practice for supporting families tools and the Trying the Life Course framework, we can have the person, the family, the community, and just the right supports and services peppered in with that, so the person can be fully integrated within the community around them. We want you to start to think about, and you may have seen these before, because I know that Kyoko and myself and a couple others went out and did the integrated support star with everybody in the past, and really starting to think about what community pieces, what are community-based resources you have, what are eligibility specific resources, what relationships you have, personal strengths and assets. And I do know you can use this star, and some of you may have tried this. I know Kathy Tamburello has been really great at putting up a future and now star, so you can look at what's in the future relationships they want to have and what else they want to have. Once you start to think about those things, so if you come to the table knowing you're about ready to be reached with all this in hand, it makes your plan go a lot quicker and to get the services and supports to fully integrate within all aspects of life. Also start to map out family roles. Start to think about the difference between caring about and caring for. So we talk a lot about, caring for a person. What are the things they need to do day to day? But what about the caring about piece? Who are those caring about people, and who do you want to ask those questions to? Because sometimes we hear families say, sometimes I just want to be mom. I just want to sit back. I don't want to be the caretaker. Really thinking about those next pieces. So as you're about to be reached, or even just as you're on the list, knowing your why. How do I get there? You can utilize some of these tools for those next steps. The other tool that's amazing is the life trajectory worksheet. And this you don't even need this bubble. You can just use an arrow on a screen. And so many times people say, I have no idea what I've reached, but I have no idea what I want in my life. I don't know what my next steps are. But then you can ask the question, well, what don't you want? And most times people can tell you what they don't want. And then you can build upon what it is from there. So thinking about, if I were to be reached tomorrow, what would I not want in my life? If I would be reached tomorrow, what would be my vision for that good life? What barriers would get in my way? How can I figure out those next pieces? So these are the tools and the aspects you should be looking towards as you're thinking about, okay, I have my ranking letter, right? What are my next steps? How can I prepare people? How can I work with my support coordinator to start thinking about the next few years where we want to go towards, knowing where it is that I am on the priority waiting list? So you heard from the beginning part, but I told you about to reach 400 people, and some people know what their rank currently is, and start to think about, based upon our budgetary scale and what we're able to outreach to it, you can start to think those next pieces. Again, you can do the same trajectory, but think about what are the past life experiences that may have worked or may have not worked. Anything that you currently have working for right now that you want to make sure you enhance, and vision for what you want and what you don't want. And start to think of all those aspects. There are, again, we'll get this information, some life experience quick guides, Trying Life Course tools. Wanted to get you just this information so you know, okay, I'm about to be reached, or here's my rank. I want to start preparing within the next 2 years I might be reached. I want to start preparing. There are some of these tools. I want to give you all these resources. Some of you may have had them already, but I just wanted to kind of throw them out there. More resources, we'll get you all this information. And after I'm done with the resources, I am just going to open it up for questions, and thank you all for listening to me. Trying to see if there's any questions that have not been asked yet. Do people have questions?
So there is a question, Trish, and that was not yet answered. I don't know if you can see it, but
I'm looking.
it reads, if a person is receiving PPP, that's a personal preference program, PDN, private duty nursing, and self-directed services from the supports program, and there is housing funds available through the supports program, what is the difference between what we are receiving and the CCP?
So the difference would be for the community care program, you have additional access to individual supports and an enhanced budget to meet all those supports needs. And you could, if you were to choose to go to a residential setting, it would be everything for all-encompassing community care program supports. And you could keep the PPP. And if you had the housing vouchers, as well, But if you're eligible, when you met the community care program level of care, then you would be able to have an enhanced budget for additional individual supports and other support needs.
And then there's another question. How do I get on the list if you don't have a support coordinator yet because you're under 18?
You need to be, first, you need to be eligible for the Division of Developmental Disability Services. You need to go through our intake process first. You need to meet our eligibility criteria. There's another question that just came in as well. Does the liaison provide a list of open spots in group homes? They will work with you and your support coordinator and figure out the different spaces that you may want to check out, maybe want to look at. They have access to our community development charts and our program development charts as to what is available at this time.
And then if both parents are moderately disabled, would our son be eligible for the priority waiting list? We are both not yet 55.
You would have to go through waiting list review team. I don't want to commit to either of those pieces without having the waiting list review team go through that. So, okay, hold on, I'm looking here.
The next one is, we are working with an intensive care manager and do not have a support coordinator. So we have received no letter of ranking on the list. Is this typical with working with an intensive care manager?
So they would, it would, if you're with ICM, it's probably some sort of an emergent situation. And yes, that is typical because they would handle it as an emergency. And then it would move you to a support coordinator, the next step. So you're back from hope. You don't know exactly the situation, but you're probably early on in the process somewhere. If you don't have a support coordinator yet, and you're not on one waiver program.
Yeah, sometimes I've seen that if they're transitioning from a out-of-state placement or
Yes,
something like that.
exactly. There's other questions. Is it difficult to switch from in-home support model to the model living outside the home in a group home, et cetera? No, once you're on the community care program, or even in a support room, you can go back. It does not matter where or how. You can go provider managed, self-directed, whatever it is that works for you to meet your waiver eligibility. If you, hold on, they're going quickly. Okay, if you reach the top of the list and determine eligible to and decide, yes, of course you can keep your family at home. Yes, you're taken off, but it does not matter because you have the community care program budget and it's portable. It goes with you wherever you're looking to go. So if you want to move out, that budget goes with you. You're on the community care program so that you can wait for and purposely plan for the next steps. It's not prior to 2012, it was a residential waiting list and you're like, oh, there's a slot there, I have to take it now. Now it's, you can be on the community care program and really purposely plan for the next steps in your life and have additional enhanced supports and services in your own home as you're seeking out the next placement or how, you know, people are aging and progressing to that next step in their life.
So Trish, just to clarify, so you're taken off the list because you're beginning to receive CCP Community Care Program services. So you're not taken off the list and I'll say penalized because you're not ready for an out-of-home placement. Because as you mentioned in that slide, you don't have to go to a licensed group home or an out-of-home placement in order to get on the community care program. You just have to accept the service and have a plan to use the services that are available in your home, in the community, with supports going out into the community. So I think that we have to make that very clear. You don't lose your place on the list if you accept CCP services. Is that?
Correct.
I want to make sure people are very clear about
They're on
that.
piece. Thanks, Mercedes. Yes, definitely. People, once you receive those services, then you're removed from the list, but that does not mean you can't take those services and receive them, whatever best setting works for the person. People on general waiting list ever get reached? So no, on the general waiting list, we are not at that point. And as people are always accessed for priority. So if they don't have ranks, how do they get selected? What the general waiting list does is it gives people, we know about people. through a waiting list review team. And also if there is a tie for where a person is on the list, it helps kind of break that tie. I think it says what is PVN, and I think they mean PDN. I'm not really sure. So, and that would be the private duty nursing that can happen with the supports program. The question is, you mentioned self-directed and program-directed services. Yes, so a person can have 1 day of self-direction and 1 day with a provider, as long as it's still considered self-direction, as long as there is some way of utilizing the physical intermediary. So it does not matter. You can use both. Whatever works for the person. We're really striving towards a person-centered system and making sure that everybody's needs are met within the proper waiver service, that they're eligible to receive services. If a group home opens up and I keep pumping. They determine eligible for my child. Do we get to choose where the DDD home? We have nothing to do with the picking of the homes at all. Once the person is reached on the priority waiting list, it's up to the family and the support coordinator to figure out those next steps. Our transition.
Trish, you need to read the full question because people can't see the question, only like the panels.
Oh, gotcha. Okay.
Okay.
So if a group home opens up and they determine to be eligible for my child, do we get to choose where, or does DDD pick the home? If we don't like our first choice, can we get another option? So again, it is, if you're on the community care program and you're eligible to receive those services, it's totally your choice where services and supports are received, in your own home, in a group home of your choosing, one that opens up soon. It's not, DDD does not do any of the choices for where a person resides. It's more of how they receive their supports and services and based upon their eligibility for their waiver. And it should all be person driven. You said that people being placed this year have been on the list since 2013. Is 10 years typical? The answer to that is yes. That's kind of where we are at this point. I wish that, these past 2 years, we've had 400 people, which is amazing. There's been strong advocacy from all over to eliminate long waiting lists or Medicaid waiver services, and that's amazing. If I submitted an application and placed on the waiting list, would I get notified the application was received? Yes, you would get notified by our waiting list review team. So you can contact one of us to check, either Kimberly, Jessica, or I, because you're saying your application was submitted 8/10/22 and you're not sure. So if our information is on here, we can also type that in. If Kim or Jess, one of you could type in your information onto that one, then we can make sure that we can check that person. Perfect, thanks. Total number on the priority waiting list seems low. Is it because not everyone knows about the list? I don't know if it's low. Some people say it's high, so I hope that most people know about the list. I hope they understand those next pieces. That's why we're here tonight, to educate you on that. And more people get put on it every year, but these past 2 years have been pretty amazing that we've been able to outreach to 400 people, because before that it was 200. And I remember years when it was only like 100. So it depends upon our administration as to how we're able to. Can you please tell us? I'm looking. It doesn't look like a question. No, the question is it a good idea to disclose on? Yes, please be as honest as possible when working at the transition education liaison. We want you to receive the best, level of care of services that best meet your needs. The waiting list is there enough availability of group homes, but it's not just about, community, it's not just about group homes. It's about meeting a person's need, wherever they may be. So it's not about just residential settings. It can be, but it's about persons, making them fully immersed in their community and supported wherever that may be. The question of applying for private duty nursing, that is through your MCO. And that's
managed care organization.
Thank you. Sorry about that. Sometimes alphabet soup comes out.
I know, it's hard.
Very hard.
The managed care organization, that would be like Horizon, WellCare, which now is changing its name. I have to remember the names. I mean, maybe somebody else knows. United Healthcare, Aetna, and AmeriGroup. So you have to go to the case manager and ask for the process for applying for private duty nursing. And it typically is a medical reason that would require nursing level of care.
Yes. Thank you, Mercedes.
Sure. Trish, I don't know if we got to this first question. I might have been distracted reading another question, but if my daughter is not yet reached on the list, can a parent pay for a group home? Is there any other way to place a child in a group home?
That's kind of a sticky situation because you need, in order to be eligible for our waiver services, in a licensed setting, typically it's funded through that mechanism. That would be between, if an agency was willing to do that, that would not be our oversight for the division, and you would not have that oversight, that division funding for those pieces.
So it would really be the willingness of the provider
Yep.
to offer a paid, fee for service, if you will, of
Yep.
A paid comparable spot in the group home until you're reached on the list. Correct, Trish?
Correct. Exactly. Thank you.
Okay, and then there's two more here, so I don't know if we got to them. If your
If your
level,
level of care was determined ineligible for CCP, how did they get on the list in the first place? What is that? So we're going to talk a little bit about what is the eligible. The list was started, let's think about this, prior to us having two waiver programs. And the list, so it was started prior to having two waiver programs. So it's based upon that eligibility. So again, we need to meet level of care criteria to be in the community care program. And for the supports program, one of the things that our team did about 4 years ago, maybe it was 4 or 5 years ago, is we outreach to everybody on the list because who are waiting for something and they may not have had anything. And we offered them the supports program. Prior to having the availability of the supports program, people were just waiting. So we had the availability to outreach to everybody and offer them supports program while they're waiting to see if they're eligible for the community care program. And yes, we have lots of different things in development right now, but we also want to see what works for the person and have it that's available, that meets the right needs for the supports and services.
so for the new people, Trish, for the new people that are joining, post the two programs being available and got on the general waiting list, is the criteria for meeting CCP level of care determined for the new folks, and it's just the folks that were pre two waivers?
Not really, there's not a clear distinction because our reg is still the way that it is. But we see that it's when people come on, it's a little bit different as people are coming forward, who need these different available supports and services. That didn't quite answer the question, I know, but
well, because what I've also heard is that, like, if you're put on if you're found eligible at 21, when you apply and you get your eligibility letter and you begin receiving support services, and then 10 years later you come up on the waiting list, your situation could have changed. So the determination has to take place as you're approaching, being put on the community care program, so that your current level of needs are established and confirmed.
Exactly. And we clearly go through, as people are reached, all of the aspects. I mean, the team that we have goes through as they're working with you, making that first initial call, and the second, scheduling a second call, because sometimes the first call is just, hi, you've been reached, your name is, I sent you a letter. The second call is going to schedule to go through with you your New Jersey Comprehensive Assessment tool to make sure that things are current. It may have been done 3 or 4 years ago and things may have changed and nobody may have looked or asked to redo it. Everyone just kind of going through their everyday motions, making sure the supports and services are there, but really looking at it and, with that critical eye. And one of the families did ask, like, do we want to present a best light? No, you want to present the real light. Like, what all the aspects that we need to have in place that someone may meet the level of care. We want to present all those pieces as they're being reached on the priority waiting list, and you're going to spend the time with our transition education liaison and work with them through those next steps.
So the wait list is mostly funding, right? Is there enough availability of group homes?
So again, it wouldn't just be for group home placement, it would be for supports and services.
But are
if you-
there, I guess the question is, are there enough group homes for people who want them?
And I mean, it depends upon geographic. There's so many variables that go into that question, based upon geographic preferences, based upon what type of a housing situation. There are different types of residential placements. So they're not going to quite answer your question because it's so varied. Each person may want one person wants somewhere close to somewhere you can walk to. Somebody wants there's specific, everyone has specific criteria, what they want for that good life and what they don't want, right? So we want so availability, we want people to be creative too and then start to think about what they're looking for.
So tell me again, what is the supports program?
The supports program is our other waiver services that can provide you the supports and services that I outlined in the one slide before. That's going to provide habilitation and community-based supports for a person. And again, the quick guide is on there as well that the council really helped us put together and put out, and we've been giving to everybody to make sure that they know.
So Michael writes that he thinks his daughter may be reached this year. Does the list go down every day, every week, every month, every hour? How's it go down?
So it does go down pretty frequently. Right now, we're almost done last year's group. So it's not going to be going down right this second, but where you were when you got your letter, if you're in the top 400, it's a pretty good guess that you're going to get a letter from us either in September or in January. We're going to reach our first batch, first 200. The team's gearing up. We have our dates for our welcome sessions, the Community Living Education Project, scheduled already. First group will be in September. If you're reached, and that's 200, the next group will be in January. So we spread them out so we can really, our team can focus their time and energies on each group as they're working them through that process. And move to the next step. And we have our welcome sessions as well. So if you think that you're going to be reached, if you're in that top 400, you got your letter right now in your ranking, and you got it in the end of June, and you're in the top 400, most likely you're going to get a letter from one of our transition education liaisons. You're going to get a call. They're going to introduce themselves to you. They're going to walk you through everything that you need to know about the next steps. They're going to talk to your support coordinator and tell them that they've been reached. They're going to help you as the health support coordinator put up a new plan for the additional supports and services you may receive. They're going to invite you to a welcome session, really help you see what it is that you may be looking for or the why you were put on the priority waiting list. Is eligibility criteria the same for emergency CCP and when you're raised on the priority waiting list? Yes. Eligible for the community care program, you just need to meet that level of care. Kim is actually responding to Tracy right now. I can see her typing the answer. Do you see an increased request in assisted apartment living versus group home settings? I don't know about that specific assisted apartment living versus group home settings, but what I can tell you is that right now, and I think I expressed this before, and it was even a higher level than Jonathan actually thought, more people are not immediately getting reached and looking for a residential placement. They're not, when we call them, they're not saying, oh yes, I want a residential, help me find that right now. They're saying, I want to find the perfect residential that meets my needs, meets my services and supports. I want community care programs, services and supports while I'm searching for that right fit and really helping them purposeful plan. So it's very interesting how our statistics have significantly changed recently. Because people want to do that purposeful planning. They want to start thinking about, and we're no longer saying, well, here's your only openings. We're saying you have time. You can look at a whole bunch, and if you don't like any of them, that's okay. You can have the supports and services within your own home and then try to figure out those next steps. Can two adults that are eligible for CCP live together in the same home and receive funding support? The answer to that is yes, but there's some additional caveats for the specifics that go into that. So that's something that I would ask you to write into Kim or Jess or I to ask the specifics of that.
Trish, can I jump in and ask a question? This is Alicia Teto.
Hey, how are you?
Good. I actually have two questions. The first question is, can you briefly explain again the difference between eligibility for the priority wait list and eligibility for level of care?
Well, explain each of them. Is that the question, or there's no
Yeah. Explain
two
why
questions.
there's two different
Sorry.
things. I think some people think that it's the same thing.
So in order to be eligible for the community care program, you need to meet the level of care criteria. So that's what I had the slide up about the ICFM criteria. So the institutional level of care. So you must meet that community care program level of care. You must meet that level of need to be on a community care program. If based upon your NJCAT scores, when your transition education liaison reaches out to you, it's not clear if you meet that level of care, they are going to work with you to do a level of care review and ask you if you want a level of care review. You can, talk about your supports program. Is that meeting your needs? Are you looking to have a level of care review? And they will complete that level of care with you and your team. And they will write up the whole information and they will submit it to the level of care review unit and then work for next steps. But they will work diligently with your papers, with all the aspects. I don't know if Kim or Jess wants to chime in. But Kim's typing, I can see, for all those pieces that the team does to make sure the level of care review is actually comprehensive and works through to see if the person meets the community care program level of care.
Thank you. And my second question, I know that you briefly covered it, but why is there a general waiting list? If it goes nowhere, if it doesn't,
Right, it's
doesn't
what
serve
happens
a
if somebody.
purpose.
I hear you on that part. It's written in our regulation. Additionally, there's a couple little nuances that go along with the general waiting list, and it's been there for a very long time. So if someone is not able to meet level of, they're not able to meet waiting list review team criteria for the priority list, they're placed upon the general list. If they were to come up on the priority list and put in for the priority list, and two people are on that priority list around the same time, person on the general list gets the higher ranking.
Oh, so confusing.
I know, I'm so sorry I had to explain that in such depth detail. And only those of us who've been at the division for like a million years understand that piece of it, because it's been in the reg for a very long time. And it's also a place to put somebody. So we kind of can earmark it though. If someone's on the general list and they went through waiting list review team, it's a way to kind of track. They already came through waiting list review team. Okay, I'm going to put on the priority list. When the people are reviewing those next things, they can see that as well. It's all seen in our system.
Okay, because I do have, a lot of parents have asked all of us actually, when we say, are you on the CCP wait list? Oh yeah, my son's been on that since he was a baby. But we obviously understand that is not the priority wait list. And so that was helpful description there to, that we can, share. It does help you in the end if you're on the general wait list.
And I just want to add a lot of questions about, I know Dottie had sent a question and Kim had answered it. But if you don't meet the criteria, we submit that, we create the reports, but we are not the reviewers of those. So there's another unit under administrative practice unit and under our, as well as our level of care review team. So we write the reports and there's another unit that actually does it. So there isn't, based upon rejection. So that, again, you're given the opportunity to appeal that, but we write all those reports. So we ask you to paint the best picture. We ask you to give us as much information. We sit down. At one point prior to COVID, we were actually going to everybody's house, sitting down with them, meeting the person, getting to know them. Now most of them are done, like we're meeting tonight, which is actually work just as well because we get to see the people and nobody has to travel anywhere and we can see things in action. So Diane, wanted you to just kind of know that when Kim answered that question, it was because we are not that we write the review. We are not the team that reviews all of them.
So Trish, can two adults that are eligible for the community care program live together in the same home or apartment and receive funding support? Can they each use full budget?
The answer to that is yes, but it really depends on the specifics of the situation as to how they're receiving supports and services. But the answer to that, of course, is yes. But we need to have, if you're looking to get a housing voucher, you need to have a clearly mapped out plan of how you're going to do it, who's going to be whose staff, if it's a provider managing it. There's all those other little nuances that go into place. But the plain answer, if you just say to me, hey, can two people live together who are on the community care program? The answer is yes. But there are a lot of different nuances that go into place with getting the housing voucher and figuring out the staffing pattern.
So another question as a follow-up to that I often hear from families is, I'm on the priority waiting list. This means when my name comes up, I get housing, I get the cost for housing. And I think that's, a thing of the past.
Yes.
Right? And so if you want to just.
So that is the thing of the past. It's, the community care program is exactly that, based upon like needs, like supports, like resources, based upon your NJCAT scores. So, it doesn't matter where a person is residing, that's their budget. Your community care program budget is your community care program budget. If you choose to utilize it in a residential setting, that residential setting is going to get most of your budget. If you choose to utilize it within your own home, you're going to be having individual supports, rehabilitation, all the other different waiver services within your own setting. So it really just depends upon, budgets aren't different. Nothing with person living in a group home versus a person living at their own home or the community care program. Community care program and support program budgets greatly vary based upon level of care and needs.
So that person is number 150. They get the letter in September. They have identified a group home. They really like it. How quickly can they move into that group home? How quickly will things come together?
So that depends. I mean, if they've already identified it, so they're working with their support coordinator, they know they're at that level. If they meet their NJCAT scores are showing they're going to meet level of care, and the house is ready for, knows about them, etc. Our transition education liaison is going to just work with the support coordinator to move on to those next steps. So that's actually pretty quick. So even if someone's in their own home, give an example, someone's in their own home, NJCAT scores show that someone's going to meet level of care. The only thing that really truly needs to be done to get that full budget is to work with the support coordinator to get a new plan in place to access that. So that can go pretty quickly. If you're like, I'm ready, that's why we want to talk to you a little bit about what can you do to prepare? How can I start thinking about it? Because if I'm 150, right? And by your NJCAT scores, I may meet level of care, I may not, maybe I need to do level of care review. Let me start thinking about what I need to do for level of care review. Or that you're going to be community care program level of care. Okay, so what do I want to put in my plan? What can I start thinking about? What other additional supports and services would I access if I had this today? And start to work with your support coordinator to those next steps. And if you come with that when we call you the first time, it's a whole lot quicker to move forward with those next pieces.
I would also add, Trish, to check with the group home, because every group home is going to be managed differently. Some might want a transition period, visits in the home, visits in the group home. So I would check with the agency as well, because they could have some timing to that process for acceptance into their agency.
Definitely, that's a definite piece. But you should be working with your support coordinator through all those pieces. And again, if you're going to be on the top of the list and you know what it is that you're looking for, and your why. Why did I get put on the list? It makes our job as the team for the waiting list a whole lot easier when we come make the first call and everyone's like, hey, here's my trajectory. Here's what I know what I want in my life. Here's what I know what I don't want. Here's my community resources. Let's help me get to that next step, rather than I have no idea. I just got reached. I'm not sure what I'm looking for. So it makes it, being the educated consumer is the best piece of it, knowing how to purposely plan, using some of the community practice trying to life force tools really are helpful to get you to this next piece.
So here's an interesting question. For those individuals who received intensive level of support under 21 from Perform Care, including a group home placement, do they move onto the priority waiting list?
They are actually worked with through our intensive case management team, and they're most of those folks are seen as emergent placements.
So they would move not having to be placed on the wait list. They would
They
be,
go on to come off.
okay.
Because of reg state, you have to be on the list in order to receive. So they go on because of the emergency and they come off. Dottie is asking if I decide I can create a good life from a person, but later things change and the person can't stay at home, do you have to wait again? You do not have to wait again. There is no waiting again. Once you have the waiver service you're eligible for, it can go with you wherever you go.
And can a person who's an NJCAT score of C, can they still be rejected based on level of care for CCP?
It depends upon, it's not based upon tier, it's based upon the NJCAT scores.
So if the NJCAT score could be varied and still have a C. So C does not equal one number, C equals a range
Correct.
of.
Exactly.
Okay. Dottie, does that answer it? I'm going to dismiss both of those. And then are there a list of group home providers to review ahead of time? Great question.
There is not a list per se of the different providers. I mean, you can go into our provider search and look there. And one of just
So there's a provider database of all providers that are qualified to provide the various services in the division. And you can search by, geography, by county, by the type of service that they provide. So that's what Trish and just put it in the chat. So you're
Jessica, somebody can put that in the chat. That would be great.
in the chat now.
My person was rejected from emergency CCP. So I'm concerned that when they reach because we as parents believe their level of care requires CCP. Nobody worked with us, only a rejection letter. So if they came through emergency, the question I would we'd want to ask is, are you on the priority waiting list? So that's an emergency. And we'd hope that you're on the priority waiting list. You can outreach to one of us and we can answer some of your questions offline as well.
So my husband and I are 60. This isn't my question. Mid 60s. My daughter is 26 and needs considerable support. I have a form to get my daughter on priority wait list almost filled out. Is there any hope of her getting housing supports really on the waiting list? Because again, it's not housing, right? It's about the determination sooner than 10 years.
Again, that just depends upon, right now we're at the 10-year point, but you can have the supports program and have a housing voucher. That is another option for people. But at this point, everybody, there is a rank and there is a place in the line for meeting the supports and services. We would want you to work with your support coordinator, explore all the community resources that are out there, figure out some of those next pieces and steps, as well as looking at the housing vouchers, seeing if that would be able to support.
And then there's also, as Trish mentioned before, there are people who are in Perform Care at 21 who are already in a group home placement and they're seen as a priority, and they kind of, I'll call it, jump the list. So if you have a situation where somebody's on the priority waiting list, but there's an emergency, there's a reason that they need support, because if not, they would be, at risk of homelessness. There's, a serious health issue going on in the home. I think that's when you want to use your support coordinator to, talk about how to get an emergency placement. And then somebody asked, what is a housing waiver? I think the term was housing voucher.
Housing voucher, and that's through our supportive housing connection. And that is a pretty much a voucher similar to that of Section 8. And that would be available to people, and you have to work with your support coordinator through those next steps.
So you can use your supports program budget and a housing voucher and be in, out of the home.
So I just put that slide up. So that, oh,
You
it
could
just
use your
disappeared.
community care program with a housing voucher and be, in an apartment, in a group home.
And there's additional information on this website right here. I just pulled it up.
Margaret, there's no more questions in the chat, so I don't know if you want to take things back over.
I'm gonna.
It's Margaret there.
Sure. So just want to thank everybody for joining us tonight. I know that Patricia is planning on rolling this training out in the fall for families, I guess, right?
Yeah, for whoever. Actually, Jess and Kim and I are looking to do something similar to these slides. This is the first time we've done these slides in this order. Just for everybody, right before we start outreaching to people. So that chronologically thinking that, okay, you've got your rank letter, really hoping that we can have that answers for people like you all got tonight. Hopefully we answered your questions, but I got my rank letter. Now what? How many people do you reach each year? What do I do? What can I expect from the next steps? How can I prepare? So we want people to be prepared. So we're planning on doing this in the end of August, beginning of September, just this pretty much these similar slides. So if you went, like I already heard you guys, you don't have to come again, but we want it out there for everybody to kind of hear. And if you do have suggestions, what could have been done better, please email us. We'd like to hear them, like move that slide, or I didn't quite understand that. Can you explain that better? We'd be glad to hear that. Again, we were testing it out. Margaret asked us to come about a week and a half ago, and we're like, hey, maybe 2 weeks ago, we're like, hey, let's try this new piece out, because we thought it was critical. We were getting so many people calling saying, I got my rank letter. What does that mean? And every year we get that, but now that we're able to reach more people, we wanted to be able to say, here's how you can prepare. Here's how we can outreach to you so that when we call you, you know what we're calling you about. You know what you want. We know your why. And it's, easier for your support coordinator to put a new plan if you already figured it out and you sat down, you started to think about what's in my community, started to think about what other sports and services do I want, what's going to get me to that good life, how can I get there? So we're working on it, but please do give us feedback. We want the feedback. We want to enhance this. We're looking to roll this out so that more people can know about what it means to be on the priority waiting list, what the myths are out there about the priority waiting list. We hear so many of them, and we have to kind of dispel them, and we want to not have to keep having those myths. So.
And remember also that, like, you need to hear these things multiple times. Like, you don't get this in one sitting, if you will. So you need to, come to Family Support Planning Council 1 meetings, or if you don't live in Morris, Sussex, and Warren County, find another Family Support Planning Council, talk with other families that are either in the same place you're at, or maybe have already moved on with, acceptance into the CCP for their son or daughter. But, I've been in the field for 40 years, and there isn't something new that I don't learn each time I come to a meeting and participate, or you need to just hear it in a couple of different ways with a couple different spins in order for things to start clicking. So, Trish, you learn something new every day too, right?
Yes.
So
Yes,
not like we all
definitely.
have
Every
all the
time, so
answers.
we're excited about our network. Every networking meeting we go to, I learn something new. Every time we have a session with families, we learn something new. Someone asks a question that we're like, oh, we didn't think about that. Maybe we should address this better. Maybe we should be clearer on this. So again, help us out. We're glad to try it out on Regional Family Support Council 1, because you're gonna do the first ones, right? So you get to try it all out.
You can start chanting now, Margaret.
Absolutely. So if you're not already on our mailing list, please sign up. It stands Regional Family Support Planning Council. So it's rfspc1@gmail. And you'll receive, slides from this eventually. You'll also receive notices when these trainings are coming. We share a lot of trainings with families, even ones that we're not doing ourselves. So, and once again, we will be meeting in September, Tuesday, the 19th. So, if you're on the waiting list, you'll get our meeting notices and we'll come on out and we'll see you. All right. So thanks again, everyone.
Thank
Thanks,
you.
Tricia and your group. We appreciate it.
Thanks, everybody. Have a good
All
night.
right. Good night.